All right. We're all here connecting, and McKinney, Deller 10, hey, Natty J. Lokes, how you doing? Welcome to both Instagram and, of course, Facebook. And let's see, I think we're on board. There we go. We're getting some. Hey, Lenny, how you doing? Hello, hello, hello. What do you suggest? Well, let's get into one right now. All right. Me, the Medina 494. What do you suggest about using intralipids and HSG before transfer? Maybe we're talking about HCG washes intralipids. So you guys may not know that my basic premise of all of this is inflammation. And intralipids is one form of treating inflammation. We talk a lot about keto, paleo diets, carnivore diets. But the intralipids is an infusion of fat that more and more we're beginning to think we might start them well before the cycle and maybe do every couple of weeks. Once you start the cycle at the beginning of the week and then weekly, maybe through the first trimester even. But intralipids helps reduce inflammation. It's the fat. It's saturated fat through either omega-3 fatty acids, fish oils, but basically, remember, Kiltz's keto was bacon, eggs, butter, beef, and ice cream. It's fat. That's the key. We have to eat fat. We're all afraid of fat, but fat is the key. So the intralipids really helps reduce inflammation, and the HCG wash, maybe adding the PRP wash a day to a few days before transfer, or even the day of retrieval may help reducing inflammation. And we've got our complete list of our immune protocols 1, 2, 3, and 4. You should be able to go to the website and download that and get that full list. If not, just ask me. I'll make sure everyone gets it mailed out. I talk a lot about different protocols, but the immune protocol is something we think everyone should be thinking about, whether it's the level 1, 2, 3, or 4. 4 is adding IVIG, Humira, and LIT. Level 1 is simply aspirin, prednisone, an antibiotic, and maybe a vaginal antibiotic. We've limited using the Cleocin ovules because it's expensive, and just either extending the doxy or adding clindamycin oral might be a better route to that, by the way. All right, hope everyone's doing well. So sad about Kobe and his daughter and the others in that crash, and our condolences out to everyone that suffered that one. But each and every day, we're all suffering from something and trying to find the way to find a positivity in our lives, even with the challenges and the hardships. It's a tough one for all of us. So don't forget, you got to dig deep into some faith and spirituality. I think it's critical for all of us as human beings. It's belief in some higher power that helps all of us cope with the challenges of life. And infertility is just another one of those. Hey, Harmony Dela Cruz, Danette, how you doing? Jenna Sue. All right, Gus Bartolotta. Do you have to do Lupron before ovulation stimulation? So ovulation stimulation is either letrozole, a pill, or the gonadotropins, either Gonalef, Follistim, or Menopur. Our typical protocols today do not utilize Lupron in the pre-stim or the stim at all. We typically are going to add the antagonist, Cetrotide or Ganirelix, about day 5 or 6 to prevent ovulation, either for IUI or typically IVF. We used to use Lupron either starting a week prior or at the beginning of the cycle. But now we use Lupron as a trigger shot in the 4 to 8 milligrams in lieu of HCG or along with HCG. So we think those are all going to help a lot. In one is the reason we don't use the Lupron because it wasn't necessary. It was more expensive. But it may be. We're looking a little bit more of the older protocols, which is antagonist Lupron a week prior to the cycle, along with some low-dose estrogen, maybe a little topical testosterone as a priming, with or without omnitrope or human growth hormone, and then switch over to the the antagonist, so agonist, antagonist, lupron, then stop it with the stim, and then add the ganirelix or cetrotide. But there are lots of different ways, and it's amazing. We're all fancy chefs with a lot of different recipes in all of these, by the way. And again, thanks everyone for joining us and continuing in the conversation. We're really working on getting to everyone's questions. Dr. Luthringer suggested maybe we take a few topics, and so we're going to be bringing those on to everyone. A shout out from all of our team members at all of our locations. We're really working to bring affordable, high quality care all over. This is one way to share the concepts of reducing inflammation, helping natural fertility. You know, this is why I talk so much about keto, paleo, remember, you can do keto as a vegan vegetarian. It's mostly one meal a day, really add the fat and limit the variety. But a carnivore keto, I think, is a home run. And my new book that I've been touching base with is Sean Baker, MD. This is backwards. Sorry about the carnivore diet. And if you go to Sean Baker's website, he's got some really great videos on recipes and stuff. But his book, The Carnivore Diet, is just another added way of presenting the story along with Maria and Craig Emmerich. I really love them. If you haven't read my keto magazine, Kiltz's Keto Cure, we're adding to a new version coming and a book coming very quickly here. But just go to our website. You can download these. If you go to drkiltz.com, you'll get a lot of good information there. All right, Jesse Mike Volker. Let's see. Hi, by the way. Do you do laparoscopy surgeries? If so, how much? So if it's self-pay, I think we're doing a diagnostic laparoscopy in the office for about $2,000 to $2,500. You may have insurance coverage for a lot of these because of diagnosis of diagnosis of endometriosis and pelvic pain, ovarian dysfunction. So we're looking at that. We include a hysteroscopy. I really recommend a diagnostic laparoscopy hysteroscopy if the diagnosis is idiopathic or unknown or unexplained, because so much we look inside and we find inflammation, either kind of a hypervascular area, which is inflammation, endometriosis, scar tissue, and by excising or vaporizing those at the time of the surgery, we can remove those, help reduce the inflammation around the tubes, the ovaries, and the uterus, and increase implantation. This is why we talk a lot about hysteroscopy DNC, where you remove all that inflamed tissue, allow fresh new tissue to grow, add an antibiotic for 2 to 4 weeks. This is where PRP, and Dr. Verdialis has been sharing with us kind of a high volume monthly PRP. Might be another idea to do maybe a 1 to 3 months with intralipids. Kiltz's keto, Emmerich keto. I'm more carnivore. Maria's now brought in a carnivore keto also, so I guess I can't say Kiltz's carnivore and Maria's and Craig's a little bit more fruits and vegetables. In my opinion, fruits and vegetables and the plants are the killers. They're the predators and we're the prey. It's a crazy concept, but I'm so on this lately, it's driving me nuts, but I know I drive everyone a little crazy, but ton of phytochemicals that damage each and every one of us. It's a crazy one, by the way. So the laparoscopy, talk to your OBGYN doctors. If you had a normal HSG, normal ultrasound, normal sperm, you can't find an answer, laparoscopy, hysteroscopies often help people get pregnant spontaneously, naturally. So talk to them about that. Any questions, please throw it our way. Any chance using Ovasitol and keto for secondary infertility due to PCOS? Absolutely. All right. Polycystic ovarian syndrome is prediabetes, is metabolic syndrome. It's basically a high carbohydrate plant-based diet. And it's a really crazy story. I just found a new magazine, Beef Magazine, and the only reason I found it had a really interesting story about Texas A&M University did a study on meat, found that it didn't contribute to cancer or any heart disease or anything else, but Harvard seemed to differ with them. But it's always this political back and forth with all of us, right? But basically, a high plant-based diet is a high sugar diet, and Ovasitol reduces insulin and glucose levels. And keto is the kick-ass home run. This is why Maria and Sean and Craig and Dr. Kiltz and all of us are really talking it up. And you probably want to shoot us over it, especially me. But remember, I honor everyone's food choices. But if you're having a problem, we got to go keto. And the term keto, it's basically a low inflammatory, a low glucose. It's a high fat diet. By eating the fat, reduces the inflammation, and I've seen PCOS suddenly go away. Metabolic syndrome gone, diabetes gone, pre-diabetes gone. So it's really the most amazing story that I'll tell you. 10 years ago, I didn't believe one bit. Now it's a home run. I believe it over everything and anything. Hey, Tamara from Mississippi, Brittany, hi. And there was a hi from Buffalo and Toronto, by the way. So shout out to everyone out there. And I'm hoping to get to everyone's questions, but you know that's a hard one. But if you email your questions for the next Fireside to rkiltz@cnyfertility.com and put a big note there, questions for the next Fireside, and we'll share it amongst us, and we'll pick the 5 best, and maybe we'll share it with the next show, by the way. All right, what is the alternative for progesterone suppositories? Natty J. Looks. So progesterone, either in an oral form, prometrium, vaginal, endometrium, crenone, or even prometrium can be used vaginally, or the suppositories that are compounded by the pharmacy can really, they provide a local progesterone to the uterus that, because of suboptimal ovulation, either due to treatments we do when we don't create ovulation, we might add just estrogen and progesterone to try to get the right environment for the lining and implantation. So it's the different progesterones, all of them are good. The shot obviously is painful, but if you don't want to use the vaginal, then you go to the IM or you do the oral. Another great one is to add the letrozole or Clomid or low-dose injectable and do a trigger shot to allow natural ovulation to bring its own progesterone up. There is some evidence that using progesterones longer, maybe even to the second trimester, may be beneficial to help reduce miscarriages. Don't forget the HCG boosters may be another way to boost your natural progesterones if you've ovulated. The HCG doesn't do that. And one of my theories, by the way, all over this plant stuff is the plant phytoestrogens, phytoandrogens, and phytoprogestins. Remember, plant-based hormones that basically act as birth control may be damaging there. There are some natural progesterones, but the endometrium, prometrium, crenone, and PIO, I think are helpful in all of this. All right, Health to Harmony. We're gonna pray, and we're all focusing our energy on a success for everyone, and we know that it's going to go lots of different ways. But the more we have faith in that power within all of us, in a more positive approach, 4 positives. So if you feel a negative, try to bring the positive. If you haven't seen my website, drkiltz.com, Mind, Body, Smile, my daily intentions, and I do have an intention book that's on Amazon. Check it out. Hey, Cammie Hiller, how you doing? And Monica, hopefully, yes, get you going. Yes, boy. You know, remember, we all need to realize we humans are a family, and lots of challenges in our families for all of us. But we have to come together with love and patience and listening to all of it. Sandy Young, right? Sharing your successes, whether it's through keto or paleo or vegan keto or vegetarian keto, whatever you're doing, those successes are really important to share on the team to help us all come together, by the way. Ovarian rejuvenation. Hey, Magdalena I apologize. Magdalena K. How about that? So a lot of what we're working on through ovarian rejuvenation, and it comes to testicular rejuvenation and sperm rejuvenation also, by the way, because the inflammation in our body damages eggs and sperm through damage to the vascular system and or depositing particles, lectins, glycans, oxalates, and so all sorts of chemicals that are in plants, basically, that cause the inflammation. And so what we want to do is we want to begin to reduce the inflammation. That's where keto comes in, DHEA, the omega-3s can really be helpful. I think the human growth hormone can be helpful, and the and remember that high-fat diet, as I mentioned. And then PRP, intra-ovarian, may be helpful. Now, if you're already in menopause, I'm not sure I know where it's going to help at all. But if you're premenopausal, there may be more value to the intra-ovarian PRP, but certainly the intrauterine high volume, as Dr. Rudialis has suggested, maybe monthly, maybe another thing to help with that. I think acupuncture and massage, and get off the treadmill. Remember, the heating up the body heats up the ovaries and the testicles and damages them. So everything you can do to basically reduce your risk of diabetes, and that's where, in my opinion, carnivore keto comes in, intermittent feasting, 1 meal a day at night. Remember, vegan vegetarians add cream or coconut oil, coconut milk, which is the fat. And if you think it's too much fat, double it. It really, really helps tremendously. And then another one that we've been talking a little bit about is ovasitol and letrozole, which is for 30 to 60 days to try to reduce the endometriosis inflammation. I think can be really, really helpful. Oh, and don't forget CBD oil. And I think the topical is great. The oil under the tongue, vaping and gummy bears, no way. I know we've sold them in the past and I've even shown them, but we're off that kick. And the low dose naltrexone, really helpful, by the way. And for those who may be on some opiates for pain control and can't use LDN, PD Labs, I think they're in Austin, Texas. Prescription Labs, PD Labs, check them out. Google them, have some really great stuff. They do microdosing for the LDN. So you're getting to 100 micrograms or less, which may be used in those patients who can't tolerate the LDN, by the way. All right. AMH have to be drawn. Let's see. Hey, Juju, the pay packages, how close does the AMH have to be drawn? The closer you get an AMH to whatever you're doing here, it's good. Remember, an AMH greater than 1 is always better. We have plenty of babies at less than 1, but this is where ovarian rejuvenation, reducing inflammation really, really comes in. Hey, Hafida, how you doing? Thank you, Lauren. A pleasure. All right, let's get over to the Instagram a little bit. Sorry, I'm splitting between two, and I'm destined to get my YouTube up pretty quick. I've been so crazy busy in so many ways. Let's see. It's just OD. All right, just Jody. Sorry about that. My wife here gets a little in the way of reading the questions. My partner is going to take Ovasitol as a 250-pound male. How much should he take? So usually I think it's 2 packets a day of the Ovasitol. And I think for, again, keto. Remember, we're lions and lionesses. We're not pigs and cows. We're not grazing animals. We're intermittent feasters. Remember, 1 meal a day, 2 at the most. If you just do that, and remember, the paleo is great. It's, again, I think the meat paleo is the best, but again, if you're vegan vegetarian, it's simply, you got to add the fat, eat less frequently, eat stuff, fresh, get rid of the processed and cereals, nuts, grains, fake milk, like almond milk. It's deadly, by the way. And really look at Maria's. Look at Sean Baker's stuff. I'm really, really excited about what Sean's doing. And he's got some stuff on Carnivore Con 2019. The more we listen to this, the more we view it. Because when I first was doing this stuff, I'm Mediterranean. I ate mostly vegetarian, a little bit of lean meat diet, pasta, fresh fruits and vegetables. But I had headaches and dermatitis and psoriasis and bowel problems and bleeding. The moment I went paleo better, the moment I went Kiltz's keto without vegetables, amazing. It's a crazy concept, by the way. But remember, the cause of infertility, when everything is normal, is inflammation in the male and the female. Now, when we have male abnormalities, it's still inflammation in the male and the female. And when we have problems in the female and it looks normal in the male, it's still inflammation. This is where Ovavite and Ovasitol for women, Conception XR and Ovasitol for guys. Don't forget the LDN and vitamin D, really helpful for everyone. You got to reduce the inflammation. Lots of cool water. And remember, coffee and tea contains tannins. Too much of that's not good. And alcohol, don't drink it. It's deadly. And I'm sorry, fruits and vegetables, those plants are the predators, and they're trying to poison us and make us fertilizer for them. It's nuts. It's crazy, I know. One of the allergic to Hennermeg 711. Hello, allergic to one of the immune meds. What do you suggest for meds next cycle? So this is one of the issues maybe with either Plaquenil or Prograf, but some people can't tolerate the prednisone or the Lovenox and even the intralipids. So we have to look carefully at all of those and look at food allergies, by the way. But, this might be where the simple approach, laparoscopy for endometriosis, I think is really helpful. Dr. Lutheran is really helping us with that. An expert in robotics, he and I do a lot. And so I think, talk to your OBGYNs about that or a gynecologist to get in there and do that. Think about the antibiotics for a month or two, along with the human growth and the Ovasitol, Orlissa or Lupron, by the way. I have to slow it down a little bit, don't I? I go a little fast. Apologize for that. We're going to keep our 3,900. We're going to keep our financing plan. And we may have a slight increase in some of these fees this year, but very little. We are going to really need everyone's help. If you do a payment plan, you got to pay. It ruins it for others who do. And we got to really keep this home run going. All right. Brittany Wisdom, what's the max stim dose of combined gonal menopur that typically used in IVF? So I've got a list, and again, it's the immune list, and the 600 combined is our typical high dose, but I've gone to 900 in a few cases. So it's either going to be 600 of gonal or follistim with 20 of HCG, or 450 of gonal or follistim plus 150 of menopur. You could do a menopur only cycle, and we might have a little bit of value to that one. That's another one we've been playing with a little bit. But if you're not making many eggs to the high dose, this is where I think the low dose mini letrozole 10 with either gonal, follistim, or menopur, 150 to 200, with or without some low dose HCG, with or without human growth hormone in it, with HCG trigger. And again, we do natural stimulated IVF cycles, 1 or 2 eggs. We do mini dose with letrozole or Clomid. We've had a lot of good responders in that. So it's another option to really reduce costs in all those medications, by the way. All right. All right. I had a laparoscopy or polyps laparoscopy, no endos. Anyone had success just doing medicated time cycle? Nikki, hysteroscopy to remove polyps and laparoscopy. Success doing medicated, is that a natural cycle, medicated intercourse or IUI? But, either intercourse, IUI, IVF, fresh or frozen, all of these things work. I've had people fail with IVF and go back to IUI and have success. So don't give up on just because what you did before didn't work. We can go on to that, back to it at any point, by the way. Oh, and another one on obesity, by the way. Being overweight doesn't cause the disease. If there's a famine and you're not fat, you're dead. And being overweight has, as we in Western medicine has labeled it, is not a disease and doesn't cause the disease. What you put in the belly, in all of those carbs and alcohol and 3 to 6 meals a day, in my opinion, is the deadly stuff. And so once you do Kiltz's keto, bacon, eggs, butter, beef, and Kiltz's ice cream, check out my magazine. I've seen so many people conceive in just a short amount of time. It takes only a couple of weeks to see the hugest change, by the way. Tanya Dawson, how many calories daily for keto? I don't measure calories at all. When you eat fat, your appetite's suppressed. If you're not running marathons, I mean, maybe 1,500 to 2,500, but I don't count calories. I don't count carbs. I try to stay away from carbs altogether. You know, this idea that a minimum of 20 grams or 40 grams, you know, if you're not getting what you want and you're on 40 or 20, go to 0. Remember, your body is a lioness, a lion in a Ferrari. It doesn't require sugar or carbs at all. Our body runs on fat, and fat is the Ferrari fuel. And if you got fat, you're already the Ferrari. And to be skinny is stupid. I'm sorry. We need to change our approach to all of this. I've seen so many women and men suddenly feel great in just a 2-week amount of time without losing a pound. And it's simply stop eating the deadly vegetables, fruit and fiber, and the seeds and nuts and the crazy shit, that we've been told to eat, which is healthy. It's not. Sorry. All right. Should I have my tubes removed prior to IVF because I have hydrosalpinx? K. Liana. Yes. So hydrosalpinx is a dilated fallopian tube due to some infection or inflammation, which could be from bacteria, yeast, or virus, or other inciting inflammatory particles that, you know, psoriasis, arthritis, and all bowel disorders like celiac are all caused by things you eat. And basically, the plant, like, it doesn't want to be eaten. It's got defenses to say, you know what, kill that herbivore or that insect and that human being. I'm going to do something to disrupt your reproduction. And basically, by going this, you'll see a tremendous amount of benefit. But those things can cause a hydrosalpinx that if you remove one hydrosalpinx and you have a normal tube on the other side, I've seen pregnancies all day long. We do have some people who would get pregnant, deliver a baby without removing a hydrosalpinx with IVF or even naturally. But it's just something that I highly recommend. Let's see. Kristen, can I order one of your shirts? So we are selling our shirts online. Miss Tamara has helped us and gotten some shirts for us. We got some more shirts coming. This one is a backwards one. So it looks right, but we'll get you some of these too, and look on our shop. We'll get Will to work on this. And if you've got some shirt ideas you want to put on with our team, and we'd be glad to do that. You know, the shirts and the socks and the hats and even the yoga pants with great stuff. We want to have fun with this. We have to try to be more upbeat and positive. We have to be inspiring to everyone, all of us, right? We're the coaching, we're the cheerleading team. The more we're cheerleading each and every one of us on this journey with a lot of faith, remember the higher power, whatever you call it, even if you're an atheist or agnostic, it's that power, that superpower within all of us, right? That's the one thing I've learned. So yes, I would remove that hydrosalpinx. All right. What kind of diet and exercise do you follow during IVF cycles, Kieran? All right. Walking a little bit, but where you going, I don't know. Spiritual meditation, light yoga, cool yoga, no hot stuff, by the way. If you want to insist on getting on a bike, go light and easy on a trail, not on the road. I don't recommend exercise at all. Be creative. Yulia is working with acrylic, and if you're not, you should paint or write poetry, play music. This is healing energy, right? Art is healing energy. Music is healing energy. Writing is healing energy. Blogging is healing energy. Communicating, having coffee and tea. Keep it low though. With our CNY fertile friends, and the more we connect in this journey, the better. And what diet? Well, guess what? Kiltz's keto is a home run. Bacon, eggs, butter, beef, and ice cream, 1 meal a day. No fruit, no fiber, no vegetables, no seeds, no nuts. Yes, it's crazy. but it's intermittent feasting, by the way. And if you check out my website, drkiltz.com, or cnyfertility.com, it's right on the front page. It's free, by the way, and so is the family building guide. It's free, right? So download it and share it, and share the keto. It's kick-ass amazing, and meat is not deadly for us, by the way, and fatty meat is the best thing you could eat. It's what lions and lionesses eat. It's really helpful, by the way. All right, let's see. I would like to start ASAP, so after my phone consult, do we start with my next cycle? Can I go ahead and have all the blood tests done before consult? Jeanette. Yes, we're trying to get everyone to get their basic blood work. You could download the order sheets to get your blood work, get it checked out, talk to your doctors, and basically thyroid, prolactin, AMH, look at metabolic, CBC, get your blood type. I do recommend that you consider full genetic testing for the sperm source, the egg source. If you're using a gestational carrier, she should get evaluated, the uterus evaluated, saline sonogram. You could bring your own gestational carrier. You could bring your own egg donor, own sperm donor. We do a lot of reciprocal IVFs. It doesn't matter your gender, you're single or married, if you're with someone or not. We're here to help you on this crazy-ass journey of infertility. But we want to spin it around. We want to imagine the fertility of all of us have already and how we're going to get to a higher level. You already begin to imagine that. If you ever read my book, The Fertile Secret, we got a new version coming out, so we're working on it. And all of your suggestions are really helpful, by the way. All right. Let's see. Would like to know if you should take metformin for PCOS if you do keto. Staying Girl Racing. All right, so some of my docs and I have a little bit different opinions. I don't love metformin. It doesn't feel good. It causes a lot of nausea, and people don't tolerate it well. I think the Ovasitol and keto, paleo, intermittent feasting. Remember, there's lots of recipes out there, but I keep it simple. Bacon, eggs, butter, beef, and ice cream, a ribeye steak, a little frog butter all over it, a little bit of Malden sea salt, amazing. 1 meal a day, and remember, boring is better because that's what makes babies. Variety and spice and sides is deadly. But 500 milligrams of metformin is kind of like the dose I would use. I would do a keto, paleo for sure. They're Weight Watchers, and I don't recommend the gastric sleeve and bypass at all. I think if you just simply reimagine yourself and get some coaching and inspiration, Marie Emmerich offers some coaching. Sean Baker has some coaching on his site. Remember, it's not about weight loss, but when you do these things and you're doing it right, the pounds will just go, but you are going to get fertile fat with a baby inside you because that's the intention here. I've seen so many natural pregnancies, but remember, when you're pregnant, keto is king, kick-ass amazing. Do not go back to the standard diet, and keto is who and what we are. It's our sustainable diet for life. I don't know what we ate 1,000 or 10,000 or 100,000 years ago, by the way, but I do know this. If you're infertile and you're trying to have a baby and you got any other medical problems, you know this shit-ass amazing Kiltz's keto, Emmerich keto, or anyone's keto, by the way, it's amazing. But if it's not working for you, you're probably eating something you shouldn't. I know, it's nuts. Is doing the HSG and SIS helpful before IVF? Key 2008. So the hysterosalpingogram, along with the saline sonogram, can be helpful identifying polyps or fibroids, but sometimes just flushing out the tubes can help. And usually if you're doing those, I recommend a week of antibiotics, might even throw in 2 weeks, seems to help a lot of people get pregnant. So before IVF, I think so. You don't have to do laparoscopy or hysteroscopy. You don't have to do those things. But it may be things that just kind of say, well, like we looked at everything. I found a small fibroid. Well, we may not take it out, but we know about it. One patient recently, 31, unknown cause, does a cycle, 8 eggs, we get nothing fertilized. And really poor quality in a lot of it. Had 2 fibroids. My recommendation was get a laparoscopy, get those fibroids out, check for endo, a month or 2 of Orlissa plus letrozole, human growth hormone, and an antibiotic, and keto, both on the sperm side and the egg side. Remember, we got to take care of all sides here, right? And that's kind of what we're talking about. We're talking about a holistic approach, a natural approach, meditation, prayer, faith, belief. Change your diet. And remember, if you're a vegan or vegetarian, you got to add the fat, double it up, and you got to really cook the carbs well and soak them, but you got to cook them. Raw vegetables, fruit, fiber is deadly, and almonds, cyanide, deadly, don't touch it, all right? I know it's nuts. Pippin76, thank you very, very, very much, by the way. There was a great article in the Wall Street Journal, December 27th, about positivity. And I've been talking about positivity for a long time, but this isn't new. It's all ancient philosophy to help all of us. The more positive we are, the more apt that we're going to see the things that are happening to us in a positive way, see the little treasures and the diamonds in those troubles, and we're going to use them for stepping stones to get to where we want to be. Whether you're going to be successful on this fertility journey, or you're going to adopt a baby, or going to be happy, or foster care, whatever it is, you have to imagine where you're at is where you're supposed to be. And you're taking all the energy and vibration of the universe and using that in your favor. And when you're more positive and less angry, sad, and mad, you can think better. You can look at the opportunities. You can Google search all these possibilities and look for new procedures and protocols and plans that I even learned from what you bring to me. Dr. Jeff Shares had some great protocols. We use some of them. We use a lot of the newer protocols, but we're open to where you've been, and we want to listen to you and offering new advice. Don't forget, inflammation in our body and outside our body is the cause of our diseases. Inflammation is caused by basically what you breathe, what you drink and eat, and what you think. Remember, what you put in the mind and the mouth, that is what matters more than anything. So every day, the more we can sit still, right? And imagine all the love we're all sharing together. And that's what we're really doing here, sharing the love. And when you share love, remember, someone comes to you and you firstly want to shout out and be mad. But if you just stop and say, I love you, thank you. I love you, thank you. And how can I be better? Oh, ho'oponopono, wali, Hawaiian philosophy. Just kind of really cool and interesting, by the way. Amanda, not retrieval with you tomorrow, OHSS risk, you still do a fresh transfer. I always say, plan a fresh transfer, you can always cancel. Have your estrogen, progesterone, whatever we need, your other supporting medications. We are adding a little bit of Dostonex and letrozole to reduce it if we think we're not going to be doing a transfer. And also, I'm looking more and more at starting low-dose letrozole, 2.5 to 5, with many more stimulations to keep those estrogen levels down, reduce the OHSS risk, and increase the number of fresh transfers. We really believe fresh transfers are a home run for lots. The data that said freeze-all is the best doesn't turn out to be true, by the way. All right. What do you suggest to get more embryos to blast? Well, this is where reducing inflammation comes in. This is where improving sperm comes in. So all those things that improve sperm and egg quality, slow it down, cool it down. Remember, Kiltz's keto was a home run. Look at Emmerich and Sean Baker's stuff. And the one thing I like about Sean Baker, he has a lot of great stories about the physiology of this human machine. And remember, we've been talking about this for a long time. It's really great to see a lot of others. Sean's been doing this for a little while also, Maria and Craig for a while. But the more you read about this, you'll recognize it's been around for thousands and thousands and thousands of years. But I think for many people, the sperm abnormalities contribute to failed blasting. But sometimes it may be worth doing a day 3. But if you're doing PGS testing, PGD testing, we have to get it to blast, by the way. It may be a one-step culture. We're looking more at that. It may be adding the human growth hormone. For the guys, it may be the LDN, HCG for maybe 3 months, and Clomid or letrozole. That can help pretty much. Let's see, Medina 494, California. We are working on California in many ways. Working on Colorado Springs, Orlando, and Florida. But remember, we're really working to share a concept and idea for everyone. We see clients fly from all over the world, but we see so many learning some of these philosophies, downloading our magazines and our books, and learning how you can be more healthy and suddenly conceive naturally. We see it all day long, by the way. Ovasitol through FET and beyond. I recommend the Ovasitol and the low-dose naltrexone throughout pregnancy, by the way. I think they really, really are valuable. Cold water, because I got to cool me down. I haven't exercised in about 8 years, and then I thought over the holidays I was feeling a little bit vain. You know, we all get that way at 64 almost. And I thought I'd get on my treadmill a little bit and my bike and do some weights. And then suddenly my shoulders hurting and my hips are hurting. And then I'm like, okay, done with that. Stick to my healthy Kiltz Keto Baby diet plan, because that's the Ferrari plan. Remember, we're Ferraris. And I stopped the exercise and my body's feeling better now. So off of that. But a lot of people love light weights, light exercise. But remember, if you heat it up and sweat it up. Oh, a little bit of dancing is good, by the way. So get with your partner, some partner, a friend, alone dancing. But Dancing with the Stars, I mean, those people are energetic and amazing, and a lot of positive power. So find something, you know, this is the part about this whole journey. If we're sitting around moping and complaining and we're down and depressed, of course. But if you find something to take your mind off to the thing that you're worried about, and we all have something to worry about because we're human beings, if you find something to take your mind off of it, and I know many people do exercise because it's a stress reducer. So find ways to slow it down, cool it down. But again, paint and do pottery and music. There are plenty of things to do that are more creative than, you know, I look at some of my pictures and people say, wow, that's really good. And I'm like, well, I just kind of threw paint at the wall. But listen, throw your art and keep going and doing it. It's amazing. It really helps tremendously, by the way. Oh, and I know there's these painting classes and people get together and paint wine glasses. Don't drink the wine, by the way. And that's the fun part. The same thing with my pottery. I get in my pottery studio. It's very relaxing. I've been doing it since high school 10 years ago, right? Not. And it's just amazing when you find something to take your mind off the thing you don't think about, suddenly you relax, cortisol and epinephrine go down, serotonin and oxytocin go up. It's all a physiologic reaction and response. It's the most amazing thing. Remember, psychiatry, the same thing. Like all of our depressive anxiety, all these things and psychosis may be related to eating a healthy diet, which is not for a human Ferrari, by the way. Sandy Young, thank you for the shout out, by the way, to all of you guys. My love and really blessings to everyone for being part of this journey, even when it's upsetting, it's frustrating, and things don't go right. We're here to listen and learn and always want to do better and recognize, remember, we're human beings who make mistakes. We're not perfect. Sometimes we even react inappropriately. And we're just trying to get all of our team members to listen more and just kind of like zip it up. Listen to your stories. We're all here together, by the way. Let's see. Again, the Ovasitol, 2 packets a day, I think. Through Theralogics, but inositol, there's lots of others out there. Does endometriosis have any effect on IVF? MAKKKD. All right, MAKKKD. So I think it does, but there are lots of women with endometriosis and fibroids and inflammation that get pregnant and have babies without surgery, without Kiltz keto, without anything, right? And so I think that if you do a cycle and it doesn't work, bad eggs, bad embryos, or just doesn't conceive or miscarries, I have seen plenty of laparoscopies, hysteroscopies, clean things out, and voila. The other option is a 30 to 60 day course of either Lupron or Avasitol with letrozole. And so I think it really is helpful. And remember, the Kiltz's keto baby diet, bacon, eggs, butter, beef, Kiltz's baby diet, which I think maybe that should be the name of the book, which we're coming out with very soon, by the way. It reduces inflammation. Hey, Donna and the global team, thank you. All of our team members, and I'm sorry if I'm not able to mention everyone. Try Avasitol. I'm ready to try everything to not have more. Ronia, it is very, very hard and disappointing, and I know. And it's okay to get there, but all of us need to come together and take the moments of sadness and mourning as we're mourning for lost friends and family members and those we don't even know, and especially Kobe and the family and other members of the aircraft. And when we all take the moment to have faith in that higher power to help us on this journey. And that's why I wear this, my cross, my ring from Miss T, and I do fly an airplane, so I'm very, very careful, by the way. Lots of training, and today I didn't go flying because the weather wasn't so great. I was going to go visit my daughter Pilar down in Princeton, and I said, you know what, not great weather, you stay on the ground. But we want to hold faith, whatever your religious or non-religious belief is in that higher power, but it's all within all of our minds together. The more we can bring that together, the better. So Avasitol plus the low-dose naltrexone, 3 to 4.5 milligrams, can be very helpful. And sometimes, not a hot bath, a lukewarm bath. You want the body to cool a little bit, and maybe even a little ice bath from time to time. I know I used to love to do a deep plunge in the cold, and boy, it was really great. And I think, let's see, Skinny Atlas is having the Winterfest coming up, and we've donated a little bit something there. So check the website, the Skinny Atlas, about the Winterfest. Come on out and join those in Skinny Atlas in upstate New York. And listen, if you're traveling to upstate New York, the weather is tame enough that everyone can get around. Plenty of people come from all over the world, and it really works. Fitspiration. Oh, I love it. High cholesterol and keto. Okay. You got to look at Jimmy Moore's stuff. I don't know if I have Jimmy Moore's book right here. Oh, hang on one second. I'm coming right back. Sorry about that. Woo! Keto Clarity by Jimmy Moore. Really great. It's when I first started. But basically high cholesterol is caused by sugar and amino acids in the liver caused by a low-fat diet. I'm sorry, keto does not elevate cholesterol. It makes you healthier. And so we have the science all wrong. We're just idiots. I know, we doctors. But the political shit that goes on in science and publication, when you read that Harvard and Texas A&M article on their beef article, and everyone's being paid by someone, it's kind of crazy, I know. LDN, it's just Jody. Again, thank you. Yes, LDN for men also 3 to 4.5 milligrams. Plus CBD oil, Conception XR for guys, and keto. Guys love it. And again, I do a ribeye steak every single day, one at night, a little bit of my ice cream from time to time, a lot of cream. But the white sugar, I believe, is better for us than complex carbs. Remember, plants have all the phytochemicals, the oxalates, the glycans, the solanase. I mean, I go down the list, it's humongous. Plants are trying to kill us. They do disrupt our reproduction. And there was a great paper I just downloaded recently, and I think Will was putting it on our Dr. Kiltz website, that basically plant phytochemicals, phytoestrogens are the cause of our reduced fertility. The animal world has seen this. That's what they talk about in all these interesting articles. Polar plunge, yes, get in it, by the way. All right. Let's see. Wanting the answer. Again, keto does not raise cholesterol. Keto is the healthiest thing we human beings can do. And if if what you're doing isn't working, why do we keep on doing when they say it? And then what's the solution? A bunch of drugs and now surgeries to help people get thin? It's ridiculous. Opinion on elderberry. I'm not a big elderberry fan. It's a fruit, vegetable, it's a plant material, super helpful for my not so good immune system. Again, it's got a plant phytochemical. Maybe it's got something in there, but in general, I think if you go keto, you're better. But this is where turmeric and all these other additive herbs, which may not be so good for our body, I think. All right. Hey, Natalie Freeman, how you doing? All right, Ken, let's see, Brittany, Shante, let's see, Ken, Eldian Cosbody. I don't know that answer. I guess anything we put in our bodies could cause something that we weren't used to, maybe. Jenna Sue, how close to transfer should IVIG be started? 1 to 2 weeks ahead of time, I would recommend, and every 4 weeks. If you started a month ahead of time and then did another one around the transfer, I think that's good. Cryotherapy, good. Alan, I don't have enough experience on the cryotherapy. Very good question. Possibly, probably. Again, I love a hot tub, but I try to not get in it much because I've had some issues in it. And but cool the body down, and cryotherapy may really be helpful. I think once again, because of the complex carbs and the compost heap in the bowels, it heats up, which damages our ovaries, tubes, and uterus, our prostate, seminal vesicles, and testicles, along with our adrenals and kidneys. And basically, I think the cause of cancer is vegetables, by the way. All right. Let's see if we got a couple of others. Is Humira good for transfer with donor eggs? Now, I think Humira LIT therapy is all good, along with IVIG. It reduces inflammation. If what we're doing on our dietary changes, or we just don't get there, which happens a lot, it's okay. We're here to support and look at all these things. Dr. Kwok Kim, Alan Beer Center. We send people to Mike Vero in Toronto, Markham Fertility, and also down to Nogales, Mexico. Maca root, Lindsay, good one. Again, it's an herbal medicine, ginger, maca root. I'm less knowledgeable because I don't know where they come from. I mean, I get a piece of beef and I add the fat. I know where it comes from in general, but a little bit anyway. But that's a good question. Donald Clark is our herbal expert through our CNY Healing Arts. I think it can be, so it's something to look at. Again, there's a lot of things that, between acupuncture, massage, meditation, light therapy, music therapy, sound therapy, Reiki, all these things are possible. And so these are things to look at. Do you do immune during retrieval, wanting to freeze embryos to preserve fertility for a few more years and want to do the best, get healthy embryos? I would say that if you're going to make embryos and freeze them, make eggs and freeze them, or make sperm and use it for fertility, either way, then whatever we can do to reduce inflammation. Inflammation is the cause of hypertension, diabetes, cancer, stroke, irritable bowel, colitis, infertility, bad sperm, bad eggs, bad morphology. And so the things that we talk about are really the home run in all of this. Let's see. Nature Time's going to be doing a show in April, coming fast. I'm going to be out in Aspen in 2 weeks from yesterday at the IVF Summit IVF, and talking a little bit about ideas that we share and how to help more people on a global level that isn't always IVF. It's really talking about the integration of Eastern and Western medicine, recognizing that IVF doesn't have to cost $12,000 to $20,000 or $30,000. You get the question, well, why? I don't know. It doesn't make sense to me. How to increase AMH and decrease FSH. Fourth is child's prey. Okay. Remember, it's the same thing. If you reduce inflammation, keto, it's a home run. omnitrope or human growth hormone helps, DHEA, LDN, CBD, but mostly the keto is kick-ass. The plants contain the particles and phytochemicals that disrupts our reproduction. It's a simple story, I'm sorry. Lettuce, vegetables, fruit, fiber, seeds and nuts, almond milk, fake milk, oat milk, it all contains the anti-nutritional components that are killing us and causing our diseases. Cancer in young people, lymphoma, is caused all by plants. And I know it doesn't make sense, but the more I do this myself, the more I see it, the more amazed at it. I've had good friends, and my sister died young. I've seen too many people suffering on this journey. It's crazy. It doesn't make sense, I know, but it's because we've been given the wrong information about how this amazing miracle machine works. We are fat-making and fat-burning machines. We're meant to eat once a day or less. We're not meant to eat like a grazing animals on four, long snout, eyes on the side, and big ears. I'm sorry. We're a hunter, but if you want to gather, then you want to eat like a hunter, one meal a day or less, because by fasting, and I call it intermittent feasting, your body's going to be the best. And at night, before you rest, then you digest. You rest and digest. You eat, rest, digest. Exercise and eating breakfast and lunch and snacks in between. The insulin pump means you must always consume sugar, and that's a deadly combination. I don't think the insulin pump is the good way to go, but it's because you've been told by the diabetic and everyone else to eat like a grazing animal. Remember, glucose and glycation is the biggest cause of our disease. And eating red meat contains carnitine, right? Which seems to reduce glycation, by the way. And I found that, which was really helpful in Sean Baker's book on the carnivore diet. Talks a lot about carnitine and red meat. Now, he does a lot of bodybuilding, but orthopedic surgeon really has shown a lot of these same things, by the way. Oh, TSH, steroids, by the way. If you have a normal TSH, we're not rerunning TSHs anymore. We're overdoing it because TSHs will go up and down during these treatments. If your TSH is under 2.5 at the beginning or soon before the cycle, that's it. If you have thyroid problems, we want to monitor a little bit, but the testing, the treatments run it out of whack. And we're also looking at T3, T4, and thyroid antibodies along with that, so we can really help everyone understand that the TSH is just a marker of the inflammatory process that's going on in our body. Let's see, Christina, ideal TSH number for transfer, I'm on Synthroid 125, TSH 2.3, you're fine, that's good. And again, a next level you draw, the TSH may go up to 3 or 4. It's okay. That's going to happen. We see it all the time. What should be feeding babies and children? Ashley, oh my God. Good question, Miss Carter. It's basically the same thing. Bacon, eggs, butter, beef, and ice cream, fruits and vegetables are not good. I think all of that is the cause of disease in children. I think when moms eat all of that, it's not good either. Basically, we're eating all the sugar that damages our children in utero and extra utero. It's the cause of disease. And the lectins and the glycans all damage the pancreas, cause diabetes. It's a nutty process. But I would say, again, the same thing. But bacon, eggs, butter, beef, ice cream. Now, there's, and again, Maria's got some really great carnivore and keto recipes. Look at those, add the fat. But the variety and the complex carbs, again, slow digesting carbs mean your glucose is going to go up and stay up. It's going to be bad for us. A simple carb, that's why you cook them well. If you're vegan or vegetarian or standard Mediterranean, my grandparents are all from Italy, you allow the sugars to go up quickly, go to the liver, convert to fat, bingo. And remember, protein, you need a lot less. The protein digests all in the upper GI tract. It doesn't go to the lower GI tract. Meat is the easiest thing to digest, by the way. We're all a little crazy. And if you don't have a gallbladder, you can still eat fatty meat. All right. Bye to my Instagram team. I'll see you guys next week. Much love. And again, blessings. All right. Facebook, thank you. Thank you. Always a pleasure. MTHFR. Yes. It's caused by a high plant-based diet. And what do I recommend? Keto, and then the immune protocol, and increase the Lovenox, the steroids, and the Ovavite contains the methylfolate. All right, I'll see you guys next week. Thank you so much for showing up. God bless, and prayers for, again, the Kobe family and everyone in that helicopter. God bless to you.